Okay, good afternoon, everyone, and welcome. We are going to get started here in just a minute with our discussion. But first of all, thank you for joining ACCE and our partners at Project N95. Today, we're going to be doing a 50-minute Partner Solutions seminar, and it's going to be titled Living with COVID, Preparing Our Communities for the New Normal. I know that it's been a tough 18 months for a lot of chambers out there, and the good news is it's getting better, but we still need to be safe as we're looking at possible new variants. My name is Beth Bronder. I head up partnerships here at ACCE, and I am very pleased to be producing this webinar today with one of our partners from N95, Manuel Kingsley. He and a group of folks at N95 and RADx are an NIH-funded nonprofit, and they're working with chambers and businesses across the country to make sure that they have access to COVID testing and to PPE products in order to keep their businesses safe and keep their businesses open. I want to thank Project N95 for supporting chambers and recognizing the leverage that we have and the power that we have in our communities. They've been a terrific partner to us, and of course, we understand how important this issue is, and it's certainly critical to economic recovery. So thank you for your partnership. Today, we're going to hear from a panel of healthcare and business experts who will share the latest insight and best practices on promoting a safe workplace, not only for employers and employees, but also for the public at large. Before I turn the program over to Manuel, who will be moderating, I'm going to launch a couple quick poll questions so that we can see where your communities are in this process. So if you would just go ahead and answer these questions, we'll share the results. And after we get through the poll questions, I'll do a quick housekeeping, and then I will get our conversation started. There we go. Okay. Interesting. We'll leave these up for just a few more seconds, and then Ellie, you can scroll to the next one. So some housekeeping items for today. Attendees, you are on mute just to cut down on the background noise. However, we love to hear from you in the chat. So please post your questions in the chat, post any feedback, any comments for us in the chat. Let us know where you're dialing in from. Let us know which chamber you're representing. It's a great way for us to know that we're connecting with you today. Also want to let you know that today's session is being recorded, and the recording will be sent to you along with any other source materials that we discuss in an email from Ellie Colt within the next 24 hours. So I'm now pleased to hand over the program to my partner, Manuel Kingsley, who is the NIH RADx Technology Team Lead, and he's going to introduce our topic as well as our panel and get things started today. So Manuel, take it from here.
Thank you, Beth, and good afternoon to everyone. So first of all, thank you for joining us today, and I want to thank our panelists again for sharing their time with us. And of course, ACC for your partnership and making this session possible and really working hand by hand with us to provide information and improve navigating the current environment. So just wanted to highlight a few things. We really wanted to put together a panel that could bring very practical perspective and a very informed perspective as well. And really help us understand what's going on the ground, what are others implementing, what best practices are they seeing to navigate rules, mandates, potential challenges from new variants that we might be emerging, and also really understand the best practices that they're helping implement or they're seeing take place. So to introduce our panelists, first, I want to start with Dr. Michael Mina. He's a MD, PhD, professor of epidemiology at Harvard School of Public Policy, but also a medical director for the clinical microbiology lab at Harvard Medical School. And his focus has been on modeling infectious disease impact in populations. So very pertinent to the pandemic. And he's really been very active at the national level, proposing ways to maximize the benefit and the impact of testing, both at the state, local, organizational, and national level. Dr. Patrice Harris is joining us as well. She's the co-founder and CEO of eMed, past president of the American Medical Association, and holds several appointments as professor at Columbia University, Emory University, and Morehouse School of Medicine, just to name a few. And she's really bringing her experience and passion around reducing healthcare disparities and patient advocacy to pandemic response. So looking forward to hearing her perspective there. And then finally, Joe Gonzalez is joining us as well. He's the co-founder and chief strategy officer of CLX Health, which is part of Sirius IQ. And he has a very extensive experience on the health IT front, clinical data management, and regulatory compliance aspects of this. He's also helped spearhead establishing effective standards across the board in some of these sectors through industry and government partnerships. And through CLX Health has really worked very closely with employers to more effectively provide testing solutions and technology to meet their needs and requirements, with special emphasis in the travel industry. So let's dive in, and we'll try to stay concise, but really wanted to bring you as much perspective as possible. So maybe Dr. Mina, you can help open the session with where are we and what has been the impact of the Delta variant?
Sure. So hi, everyone. Thanks for joining. So to give a bit of an update about where we are, I think probably anyone on this call has been certainly keeping up with the media about it. But where we are is in many ways exactly where we anticipated we would be. We of course have a very useful vaccine right now that's keeping people out of the hospital. We have an infrastructure that has kind of been in flux in terms of what are the mitigation strategies that the country is now taking to prevent further spread. And as of this summer, we've really had Delta come through the United States and take over as the dominant strain, of course. Delta is important here. It is on the continuum of what we expected would occur. It's a virus that has a few additional mutations that is enabling it, unfortunately, to continue its constant march forward. And unfortunately, it is able to spread quite well amongst vaccinated individuals. Now, importantly, it is a virus that is not causing significant disease in most vaccinated individuals, but it is able to spread still. And that means that it's become very, very difficult. The silver bullet we hoped for in terms of vaccines to essentially bring this pandemic to a close didn't pan out the way that we had hoped, and transmission is still able to continue on, not unabated, but quite readily with this variant amongst vaccinated, and then of course also amongst unvaccinated. And so that brings us to an inflection point in this pandemic where we are trying to reopen. We have schools back in session, many businesses are fully back open, and there's a lot of confusion. Do we wear masks? Do we test? Do we force vaccination and mandate it? And so these are obviously questions that need to be happening right now. But the important thing is, regardless of any of these, this virus is going to continue transmitting. And we're not yet at a point where we have so much community immunity that it's not causing a significant number of people to go to the hospital or die. As we see, we still have thousands of people who are dying every day still in the United States. And so we need to continue to take crucial measures to stop transmission, particularly amongst the vulnerable, but that means to slow transmission amongst the entire community. So where that leaves us is continue our efforts to vaccinate as many people as we can, boosting, and now with the FDA guidance that's going to come out soon around mixing vaccines. I think it's very appropriate. It's the smart move. It's going to facilitate increased vaccination uptake and booster uptake by not requiring Pfizer, but we can mix and do Pfizer and Moderna, for example. But we're also seeing a need to continue to limit transmission. And that's where rapid tests and PCR testing and testing infrastructure in general becomes extremely important. And it's not vaccinate or test. It should be vaccinate and test. We need to have a tool that's stopping people from disease. And then we need to have a tool that's giving people knowledge that they are infected and infectious, and gives them the right amount of knowledge to know, am I infectious now and therefore a risk to my peers or my colleagues, and not go to work or not go to family dinner that evening. And so this is becoming a particularly crucial tool for reopening businesses and stopping onerous quarantines. And we're going to hear more about it as in this session. But we are really at a point where now we have to focus on, okay, how do we stop the outbreaks from emerging, and while also allowing society continue to run smoothly. And unfortunately, we're just not, the vaccines aren't going to be all that's needed. And so testing and other mitigation strategies are absolutely essential.
Thank you. Dr. Harris and Joe, would you have any additional comments to add to that?
I just want to wholeheartedly support that. And in fact, I of course don't have it on, but Michael mentioned that we typically in our society like to look for the one, magic wand solution, a one size fits all solution, the one thing where in fact, where Michael ended was we need an all of the above approach. And we've needed that from the very beginning, and we still need that now. I saw a question around, do we still need to test now that we have vaccines? And the answer is yes, because I have a t-shirt that says yes on vaccines, yes on testing. And if I could, I would add yes on mask wearing where appropriate, yes on physical distancing where appropriate, and finally, yes on data, because we need to have the data of where we see outbreaks, where we see clusters of positive tests, so that we can then act on that data. We need that from a public health perspective. And I imagine the folks on the call who are running your businesses every day would like to have this data too, so you can know how to make sure your employees are safe and healthy. So that I would like to add that. And again, it's not sort of a one size fits all approach, but it's all of the above.
Yeah, and just to compound with Dr. Harris and Dr. Mina said, I think as we look at vaccinations and the recording of those records, having access to those certainly becomes important downstream. And the testing part, I think, is a critical linchpin on dealing with this. We as an organization, we have a focus on testing. But I think the key component of testing isn't just is it available. It's creating access points in that infrastructure Dr. Mina referenced. How do we as a country working with all these businesses identify providers and make sure that those providers are meeting the requirement from a reporting perspective as well, and that the tests that they're supporting have the level of efficacy that all of us hope for. So there's a bunch of different layers to testing that we can dive into, but all of that, all of the above approach is certainly what we need to focus on.
Thank you. And continuing on that same vein, really is our kind of second question. How are businesses leveraging testing to stay open and avoid disruption? And maybe complement your answer a little bit with how should the business think about the value of that testing for them? And would you like to start, Dr. Harris, on this topic?
Yes, because certainly, as you note, I am the co-founder and CEO of eMed. eMed is a company that has developed a digital health platform that enabled diagnostic testing in the home. I happen to be president of the American Medical Association during my term at the beginning of the pandemic. And I was so frustrated, as I imagine all of you on the call were, with the long lines that I saw. We saw people waiting in their cars 10 hours or more just to get a test. And then when they received the test, they were waiting 3 to 4 days. So they didn't have immediate knowledge, right? Immediate actionable data to make sure that they were safe to go back to work, perhaps because a lot of those folks were our essential workforce, as I recall. And so that was critical data that was, first of all, difficult to get to. And then when you got the test, you didn't receive the data immediately. So I know that this has been important for businesses to have that data and to be able to stay open. And Michael and many others, we've talked about test to stay in school and test to stay open, in businesses. And so, yes, this is a critical piece of what businesses should be thinking about. Again, even though we do have vaccines now, as people are coming back to work, you want to know. And I imagine not only you want to know who is positive and who is not, you want to be able to get that information in a way that's least intrusive, least disruptive to your workplace, least disruptive to the employees. And so based on all of those data and our desire to eliminate barriers, again, particularly around those who did not have access to testing, those in rural areas or those who were disproportionately impacted, we developed this platform and partnered with the testing company so people could take these tests at home, but take them in a way that there was confidence in the process. And so we proctor and guide and monitor and then report the data. So this is on the minds of a lot of businesses. We've been receiving the calls. We currently have a lot of businesses. We work with several airlines, several large employers, small employers, schools, states, governments, government agencies. And so people do want to be able to get us all back to work. Remember, it's not either or. It's not public health or business opening. It's both. We just have to have the appropriate strategies and testing protocols in place. And I'll just end with one more thing, because I want to make sure we have a finer point on this. The tests in and of themselves are just the initial step, right? They're necessary, but not sufficient. You need the testing infrastructure. And, some people, we saw you need nurses, you need PPE, but why don't we look at innovation and technology so we can reduce some of the costs of the infrastructure going forward? And that's what we did at eMed.
Thank you. And Joe, I'm sure CLX Health is seeing some exciting things on this front. Love to hear your comments here.
Yeah, so we actually, as an organization, we've become a component of that testing infrastructure. So in a pre-COVID world, we were managing clinical data for several hundred laboratories and coordinating with health plans and providers. And in a COVID world, we actually were able to repurpose that platform, and through our different partnerships, similar to, I think what we become is that complementary part that eMed has for the in-home. There are some people that are just not comfortable testing at home. It's just, the way some people are. And, as we also work with several airlines and large employer groups, we provide that brick and mortar network that some people are just comfortable with, going to a location like a CVS, like a Albertsons, a Safeway, a National Pharmacy, all partners of ours, where they can actually schedule through a platform and get confirmation and just show up with their ID and get swabbed and be able to not be concerned about when those results come back, because everything is controlled within an ecosystem that we manage. So, where, as Dr. Harris referenced before, folks are waiting 5, 6, 7, 10 hours online to get a test. A lot of this is predetermined through scheduling, and those results are controlled through service level agreements. So there is infrastructure out there. I think from an employer perspective, we recognize that different employees serve different roles within an organization. So if the ones that we work with and that have several hundred thousands of employees, they start to target and set up cadences for different roles. If you're If you're a person in an organization that deals with the general public on the regular, you may have a more abbreviated cadence, testing every 3 days, every 5 days, every 7 days. And if you're someone in the back who does administrative work, your testing may be every 7 or 10 days. Again, organizations are determining what they feel is the best for them. We look at it as trying to be a clinically sound type of, taking a clinically sound type of approach, making sure that whatever it is, that the reporting is there, and then more so that level of privacy is included. Their organizations need to concentrate on, yes, testing is a piece, but one of the things that we saw that didn't really work with contact tracing in the beginning was people felt like their privacy was being invaded upon. So the messaging, I think, is important as you communicate with different organizations. Is someone ready to work or not ready to work? Ready to travel, not ready to travel? So, and all of those are really based on the requirements of the employee workplace, of the destination, so that when a testing methodology is developed and agreed upon, that, if you decide to take a test and that test isn't the approved test by the destination or the workplace, you're not singled out as someone who could potentially be flagged as positive, right? Hey, Joe didn't show up to work, he must not be positive. No, he probably took the wrong test. There's different iterations. So there's got to be concerns and layers around employee consumer privacy that I know we're focused on. I know the folks at eMed are focused on, because we work with them on different projects. So that, as we look at this holistically, making sure that whatever solution an employer or a certain use case employs or decides to use, that they are aware that these are all concerns that the consumer has about what data is shared, how are they handled, and then what the limitations on that data use are, right? Does that data use have expiration dates, which we certainly employ on our side? Because these are all things that the consumer doesn't want their information out in the ether to be used, by an Apple or a Google or whoever, not singling them out in particular, but these are the concerns that they have.
Thank you. And the benefit of time, wanted to move us ahead, wanted to recap on a couple of things I think I heard you both say collectively. So really talking about the appropriateness of the test to the use and the purpose, the time it takes to get a result, the preferences or needs around where that test takes place, and how you match the person taking the test in the organization. And you're raising concerns around data management, privacy, potential exposure on that side, and it could be concerns too for the different constituencies that businesses are interacting with, either their customers, employees, or others. So wanted to move a little bit more into maybe two key areas. One is, what sort of solutions, you both mentioned innovation, right? So what sort of solutions are you seeing around testing, vaccination record, maybe workforce management? And then some of the best practices that they're emerging now in the business environment.
So is that towards me, Manuel?
You go ahead, please.
So what we've developed on our end, and it's something that, to qualify, we've been managing vaccination records for our airline partners for going back almost 7 or 8 months since vaccines have been made available. So there are two components to that. One is utilizing AI to understand what could potentially be a false record, or we don't ever accuse anyone of doctoring or manufacturing a vaccination card, but our AI has reached a point where we can identify what lots, what manufacturer, what lots, where they were distributed, based on our network and what we see often enough in a certain geography. So the example I like to give, that if Joe Gonzalez, who received his Janssen vaccine in North Carolina with a certain lot number, that if that lot number shows up as being distributed in California, we may flag that card as saying that we're not saying that this is a fake card, but this person might need to provide additional data or information to prove that they indeed were vaccinated at that location. So, and in some use cases, we don't get a challenge. We've had the occasional challenge, but again, not accusing anything of anyone of anything. So there are also attempts at utilizing the registries and doing real-time, what I would call real-time verification. The challenges with that, as they exist today, is that the registries aren't updated in real time. They weren't designed to do real-time verification hits. So there is development that needs to be done, across the registries. Unfortunately, there is no central database maintained by the CDC where we can actually validate someone's information. And then the other challenges are that we've had, for the benefit of the general public, pop-up vaccination locations that have not supplied the necessary records to update the registries in those geographies. So now you have people running around different states and municipalities that have a vaccination card. They were vaccinated. They have that, but that record isn't appearing anywhere in a city or a state registry. So these are all challenges that we're dealing with on the vaccination record side. I think AI is the short-term solution as this starts to mature, and it's our hope as we deal with the different state registries and build those rails as they become available, that information reaches the point of maturity that it is updated in real time, and we can verify, based on what those state registries have, or even working with certain providers like a CVS, like a Rite Aid, like a Walgreens, that in most cases are supplying the 2 inoculations, right? So that they have records of 2. In some cases, they're only seeing a second shot, or they're only seeing a first shot. So these are, again, disconnects in the system as far as where that is. And then followed up, as we've been talking about since the beginning, is that testing, those testing requirements. How do we marry them? It's all very fluid, as you can expect. With these new requirements that are coming from the federal government, from OSHA, there's become a run. There's a supply chain problem now around testing. There's a run on testing materials, and what we're recommending now is, if employers are looking to have testing as part of their employee strategy to get back to work, that they order an inventory up to 2 months, because we don't know what the fall and the winter is going to be like. So these are all things that we're looking in consultation with our customers, whether it's an employer, whether it's an airline, whether it's even, a pharmacy chain. What do you have? We're looking at these peaks and valleys as far as utilization goes. We monitor air traffic. We're bracing for the holiday travel season. So we know that there's going to be, Canada and Mexico opening up. So you're going to have an influx of people coming in, and then a requirement to come back. So that's going to put a strain already on the testing supplies here in the US.
I wanted to ask precisely about, sorry to interrupt, Joe, maybe even ask Dr. Harris or Dr. Mina to comment on this point. You've risen a key challenge that's out there today, acquiring, supply of tests. Are there any things that are happening to make that more efficient, maximize, how you can use it, the value of doing a test, for example?
Well, I'll start and then let Michael, give us all of his wonderful wisdom. But yes, I think recently the announcement by the Biden administration, or their investment in all kinds of tests, but particularly the rapid at-home antigen tests, that was very welcome from our point of view. I'm sure from your point of view as well, because businesses have been calling us and talking about the demand. And I agree with Joseph regarding making sure that when you are ordering, you're thinking long-term. so that you are not reacting to a crisis, but you are proactive to make sure that you can meet the needs of your business. But again, it's the test and the testing infrastructure. And I think Joseph mentioned the importance of being complementary and having strategic partnerships so that from the business side, and that's our commitment to businesses and any of our clients, it's seamless to you, right? And so we have been all along making sure that we were developing these strategic partnerships so that we can offer that. At eMed also, we pride ourselves on flexibility and working with our clients and customers to be able to meet their needs. And if there is some integration necessary, we can have our fantastic tech team work on that. And then Joseph made a lot of the other points that I think have been critical. So we are seeing a shortage right now. The demand is high. And so we need to think for the long term and be proactive.
Thank you.
I think one of the key pieces, so companies as companies are trying to make sure that they can keep their workforce running, stopping transmission is of course crucial, but also following guidance and OSHA regulations that are about to come out, and so there's going to be a lot of questions around testing. I think to Joseph's point, getting early access or not early access, but securing 1 or 2 months worth of tests seems to be what has enabled most programs to run forward. Schools have been doing this really since the middle of last year, for example. Universities and many businesses have taken to it. One of the biggest issues that I hear anyway from companies that call and ask for advice and whatnot is how do we actually logistically do this? Do we have to go out and find a nursing staff to swab people when they come into the building? Do we base it on the honor system? And there's a lot of different approaches, and some of it depends on how trusting the company executives are, and some of it is what is the risk benefit ratio. But it's one of the major pieces that I think is going to become increasingly crucial with COVID testing, and frankly with all testing, is going to be continuing to keep the chain of custody of the test or the authenticity of the test to authenticate, yes, John Doe did in fact do the test today. We know that it was John Doe's swab and that the test ended up being negative. To be able to do that from home is incredibly important for businesses because most businesses don't want to take on the logistical hurdles of hiring nursing staff or other businesses. Now, there are, of course, organizations that will do it, but every company has different needs and desires, and many of them have chosen to try to get testing done at home and are thus far generally relying on honor system if they're doing that. And that's where a company like eMed, I think, comes in as particularly interesting in this domain to say, hey, we have a tool that actually authenticates that your employee did in fact use this test today and was in fact negative. And so it's okay for them to come to work. So it takes the guesswork or the honor system out of that issue while still enabling people to be able to use the test from their couch. And so I think that these tools and the continued scaling of a lot of these different tools is going to just be crucial for getting us, not just between now and holidays, but really for dealing with the endemic phase of this pandemic until as we move into an endemic phase, rather, over the next year or two, we're going to be needing to continue contending with outbreaks and having systems that are sufficiently simple for companies to bring on board and kind of a turnkey solution to say, okay, we can scale this up and down within a day's notice, and distributing the testing efforts to people's homes, I think, is absolutely essential for that.
Thank you, Dr. Mina.
Just one quick point. Sorry, Manuel. Joseph and both Michael were very diplomatic, and I am always diplomatic too. But, I, as a psychiatrist, have made my career out of studying human behavior, and people do lie. Unfortunately, I wish we lived in a world where people didn't lie, but they do. And we've seen it for various reasons, and that's not important. So here, I think we should fall on the wise words from a former president, Ronald Reagan: trust but verify.
I think, and just to add to that, Dr. Harris isn't wrong. We, as an organization that scans vaccination cards and test uploads, tens of thousands of them a day. We see some pretty interesting versions of what a COVID test could be or should be. So yeah, and we challenge those and we alert our partners and let them know this is something that that we've flagged, and then they make a decision as a business as to how to proceed. So that's what's happening. Yeah.
And I saw a few questions in the chat. I don't know, Beth, if you wanted to highlight,
we
one
have
or two of those.
a couple good ones. I know that Dr. Harris has a hard stop in about 10 minutes. So I'm going to pull the first one out here because she mentioned human behavior. And we all know that it's very hard to change. But one of the questions here was whether or not you've seen any effective messaging that has really broken through to the groups in the community that have been most resistant to the vaccination.
I have, and when we get on the other side of the acute phase of the pandemic and do sort of the after action review, I think public health messaging will be critical. And I was out there up front at the very beginning of the pandemic, and I'm sure I could have improved upon my messages. And so I think we will learn, but I think the key thing is there is no one size fits all approach. So let's just take the vaccine. Those who didn't want vaccine, actually, I'm actually beginning to, no longer use vaccine hesitancy. But there were many categories, right? There were those who were just not going to get a vaccine. They were anti-vaxxers. They believed that there's a chip in the vaccine. That's a different category of folks. And let's just say maybe in the Black and brown community, but because of past studies and poor treatment, actually I say past and current, there was a distrust in the medical system. So you'd have to, maybe for even that one category, there is no message, but I think there are so many persuadables and they fit different categories. So the key is to find trusted messengers within that community, not have a one size fits all approach, meet people where they are. I found one-on-one, after the big, large public messages and you do that, sometimes it was that one-on-one, even with some of my family and friends, and meeting them where they are, finding out what their concerns are, which may be different, and then giving them trusted, credible information. And I think that's all of our challenge. I think there's one question that you may get to after I leave is where should businesses come for information? And I think ACCE is great. You find those places that you usually rely on for other information, your particular industry, or like I said, ACCE, and just come to them for places of trusted, credible information, and encourage your employees and others to make sure that certainly they ultimately will be making a decision, but we want people to make a decision based on credible information.
Anybody else have anything to offer on messaging, ways to break through? Chambers obviously are those trusted communicators, so I think they're just always looking for ways to really cut through the resistance.
As far as testing is concerned, one of the great things about testing, in particular rapid testing, the messaging can be tailored very, very nicely to individuals because it can be a tool that is fully reported to the public health agencies, and that message tends to go over well, in the Northeast. But you go to the Southeast and you see that there's great hesitancy or great reluctance to have medical data shared with government agencies. And we can't say that this is wrong. This is, in America, we have taught people from the time they're babies that to hold your medical information tight and close to you and, don't give it out. And so then we start to say, well, we have a pandemic, so everyone should know your information. So we have to first understand where people are coming from. And I do think that the messaging around rapid testing, for example, can be tailored. It can say, look, if you're absolutely against, having your test reported, at the very least, just use your test in your home. We'd rather you know that you're infectious than nobody know that you're infectious, including yourself. And so I do think that understanding where people's resistance lies is always, of course, with any conversation is always important to recognize. And I think that finding the right tools and pushing on the right tools for different settings, and there's a lot of different tools in this pandemic, and they're each going to be better or less well utilized in different groups, is just essential. And I found that getting admitting one of the biggest things is to either admit that we're wrong when we are wrong, and to recognize exactly what people's hesitancy is, and fully embrace that and say, yes, we hear you. I mean, it's kind of conversation 101, but I do think that is often lost in public health messaging, where we tend to just force things down people's throats, and that never goes over well, as far as I'm concerned.
Thank you. And thank you so much, Dr. Harris and Dr. Mina, for, I'd say, bringing that topic to bear, because we do tend to generalize and think there's a single problem, a single solution. And you guys are really hinting to know, when you look at a region, a state, a company, and even within that groups, there are different concerns there and they need to be addressed differently. So make sure we take the time to look at that and treat each one as we should to really solve the situation. So I would love to get maybe 60 seconds, 30 to 60 seconds from each one of you on what should businesses expect 2022, potentially, you know, a little bit after that. What should they be prepared for? And we can follow up with questions and resources over email, that I know ACCE will send out to all participants as well. So maybe Dr. Harris, why don't you give us your 60-second, you know, take home, and Joe, and then Dr. Mina.
Well, in the short term, we are entering the cold and flu season. Let's not forget about flu. And so I think businesses should look for regional variations in infectious, in outbreaks. Perhaps we hope that we will be able to tamp them down to levels that are manageable, and we won't get to crisis standards from hospitals, although we've seen that in certain states even over the last 30 days. So I think businesses should expect, and I don't have a crystal ball, I don't have any inside information, but some rules and regulations from OSHA, and the need to figure out how to keep the workplace safe and healthy in the midst of the context of a cold and flu season, more people back to work. I know there's a lot of conversations about in-person, hybrid. And then I think, of course, COVID will likely be endemic. Dr. Mina has said this before, and many others have said this will be endemic. And so we will learn how to manage this. But the other key thing I want us to also think about is, and I have to get this in as a psychiatrist, sort of not related to the topic of the day, but preparedness. And there will be additional pandemics, right? And so there's got to be a lesson learned here that we need to make the investment in the infrastructure for preparedness. And then this has been very traumatic. Our lives have been disrupted. Businesses, I know you know this. I know you know that a significant amount of your dollars is spent on mental health. And so just as we should be proactive and develop preparedness protocols regarding COVID and future pandemics, we should also do the same for the mental health needs of your employees.
Thank you. Joe, please.
Yeah, so to add to what Dr. Harris was saying, you know, we are getting into the cold and flu season. You know, the discussions that we're having with our different partners and clients is, if you do have an employee, a consumer, or anyone that you're working with or connected to that requires a test, then look at multiplex testing. You know, COVID test plus flu A, flu B, the symptoms mirror each other in several ways. So you don't want to you know, tap an employee out or a group out based on what how they feel. Have them get that right type of test so that you really know what you're dealing with short-term and long-term. And in agreement with Dr. Harris, this is not something that's going to go away. This becomes now how do we manage this for the future, you know, years and years of knowing that COVID is here to stay. And that's, you know, that's the way we're treating it. That's the way our partners and clients are treating it, that this is a long-term strategy on managing their employees, managing their consumers, making sure that they're making all the right decisions. And the other part that I think we need to focus on is provide options. You don't want to force it. I think as an American, no one wants to have anything shoved down their throat or forced. You don't want to be forced into a funnel. So let's not use the shaming tool because it doesn't work. Shaming someone into a vaccine or anything, give them the option of having a test, make them feel like they're like, once you've provided options, you put the ball in their court and they're making the decision to either participate or not. Here are your options. Here are your choices. And I think that's a lesson for us, just, big picture wise. Let's not get into the shaming game because it doesn't work. It never works. And it just creates animosity and polarization around this whole topic.
Thank you. Very good message. And maybe Dr. Mina, please give us your perspective on what to expect. I don't know, Beth, if there's a question that you wanted to add.
Actually, Dr. Mina answered it partially. One of the questions that came up, which I think is really worth touching on, is how do we counsel businesses on finding credible information, making sure that their testing is quality, making sure that they're not getting, either information that's misguiding them or sending them, in the wrong direction. So any thoughts on that would be great.
Well, it's been one of the major challenges, and it's truly an existential challenge at this point because of social media. Where do people get right information, and how does somebody even know what's credible and what's not? It's extraordinarily difficult to know this. And there isn't a good solution because frankly, even CDC has been quite incorrect on many occasions in this pandemic. And so, and that's for a lot of different reasons. So unfortunately, I don't think there is one good answer for this. It really takes having, I think one of the most important things that businesses and, city leaders and state leaders and others can do is to recognize who their advisors are, to recognize what the true expertise of their advisors is, and make sure that they're asking the right questions to the right people. And that's been a major problem throughout this pandemic, is the wrong people have been asked, or the right people have been asked the wrong questions, or vice versa. And so we've gotten a lot of people who have been surprised. I would argue that very, very, very little of this pandemic has been a surprise. Almost all of it has really played out almost like a textbook. And the reason it seemed so surprising at every turn is because we have a lot of voices. And so how to pull those voices and find the appropriate ones is a real challenge. And I don't think that's a question that really, unfortunately, has a solution at the moment. Find people that have been, probably there should start to be some database. Like what have been the sources that have been more right than wrong throughout the pandemic, or something along those lines, and try to convey those. But again, it's going to be so polarized based on where you are. What is right and what is wrong is not even, there's no truth there. It's, so much of it is perception. So that's a long-winded way of saying that I don't think there's a good solution. And it's truly one that is being born out of just the major shifts in media that we have in social media and real media, that we don't have, that is still kind of a Wild West, I would say.
Well, I appreciate your comment, Dr. Mina, in chat about ACCE providing that role. So I would ask if any of the experts on the call today have resources, links, anything that you want us to include in our COVID guideline. We do a blog every week that we're just constantly updating. If there's anything that you think our members need to see, or is something that they can pass on to their businesses, we would greatly appreciate that. I think we're just about coming up against time. I'm not sure whether Dr. Mina answered that question about forecasting for 2022, though. Anything that you're seeing that we should be prepared for, or just more of the same?
Well, I think what we should expect for 2022 is for this to, we're going to see probably another, just as time goes on, we're going to start to see waves that continue to occur, but are going to be blunted more and more each occurrence. Nobody should expect that this virus is going away in 2022. We'll see a lull in cases for sure. And then it's going to be a tick up again. So I think everyone should recognize that that this is going to continue in this sort of wave-like fashion. The big unknown, but a possibility that's quite real, is that we'll have another variant that is going to be bottlenecked and kind of pressured to continue evading immunity more and more. And that could certainly extend the duration for which this virus is really having a significant impact. It could even go so far as to really greatly lessen the benefit of vaccination. We now have a whole population of people around the globe who are getting vaccinated, and that pushes the virus in a direction where it's going to do everything it can to specifically work itself around vaccine-derived immunity. And so we should not be surprised. We should certainly prepare for an eventuality where we have a variant that is able to do a much better job at getting through our vaccine-derived protection. And unfortunately, that means we'll probably still need to go through a few more rounds of vaccination and boosting, and hopefully not any more rounds of quarantining. I think that the most important thing about testing is we can get rid of quarantines by knowing who's infectious, and we can keep pushing society forward. But this is unfortunately just not going to be coming to an end until, at the very least, maybe we'll get cases low enough by the middle of next year that we can really keep them suppressed as we move into the fall. But I think that would be asking for a lot at this point.
Thank you. Manuel, I'm going to give you the last word before I wrap things up. Anything you would like to say or share?
Well, first of all, thank you again for hosting us. And I think a couple of points that are key around, especially the information quality and relevance. The way we've understood, COVID as it's evolved, just the scientific data, the information has, on many occasions, lagged, and therefore has led to our changing policies, guidelines, approach as we go. And that's, I think, Michael alluded to that kind of being a reality. I think to put Michael's comments in a slightly more positive note, we are also learning, and we're also putting in place systems to better manage the risk, and at the same time do more activities and return to, we could say more normalcy, but really like a new normal state where, this is endemic. We will most likely have treatments, we'll most likely have challenges, but we're also kind of learning to continue to operate and do the best we can. And, testing is one of those fundamental blocks of making sure we stay safe and we monitor the situation. And we, even if it's ebbs and flows, we go towards improvement overall, right? So thank you so much. And there was so much here to discuss and talk about. So really appreciate both of you for participating. Dr. Harris, although she had to leave, also her perspective was really valuable. Hopefully we can send a good packet of resources through ACC to folks as well. So thank you.
Manuel, thank you. And thank you to your colleagues and the folks at RADx and Project N95. We've enjoyed working with you. We know how important this is. So anything we can do to get accurate information out to our chambers and then in turn out to businesses, we are here to help. So with that, I'm going to thank our panelists, Michael, Joseph, and Dr. who had to leave. I want to thank all of our participants today for joining us and adding to a very robust chat function. It was good discussion going on there, and I appreciate all the back and forth. Want to remind you that you will all receive a recording of this session, so please feel free to share it with your colleagues or share it with your business members if you think it would be helpful or useful. Manuel's contact information is here on the screen if you have any direct follow-up, and you can also follow up with me. That will close out our program. We look forward to seeing you again soon on another Partner Solutions session. Thank you to all of our participants, and everybody, please stay safe out there.
Thank you.
Take care. Thank you again.
Bye, everyone.